Zenrelia is a prescription medication that relieves itching and controls atopic dermatitis in dogs over 12 months old. The recommended dosage is 0.6 to 0.8 milligrams per kilogram, given as an oral tablet once every day. Zenrelia works by blocking inflammatory pathways that cause itching, redness, and skin irritation from allergies. It helps treat allergic dermatitis, atopic dermatitis, flea allergy dermatitis, food allergies, and contact dermatitis. Zenrelia tablets can be given with or without food, making daily treatment simple for most dogs. Most dogs tolerate Zenrelia well, but vomiting, diarrhea, and tiredness are the most common side effects. Less common side effects include urinary infections, ear infections, increased thirst, and elevated liver enzyme. Never change the dose or stop treatment without your veterinarian's approval, even if your dog improves. If an overdose occurs, contact your veterinarian immediately. With proper veterinary guidance, Zenrelia provides effective daily relief from allergic itching and improves your dog's comfort.